DeKalb County woman is one of the first in Middle Tennessee to be jailed for doing drugs while pregnant. Law enforcement agencies can now seek criminal charges. It's a new law that went into effect last July.
News Channel 5's Andrea Klein-Thomas looks at the broader problem and the impact the law is having on treatment facilities. Andrea?
Last year, more than 700 drug-addicted babies were born in Tennessee. A local agency says treatment and not jail time is the only way to address the problem.
A call to the Addiction Campus's hotline.
He's drinking alcohol. Is there any other substances?
It's a cry for help.
Then our treatment team's going to decide to see what's going to be the best help for him to get him off of this vicious cycle.
Many of the callers are pregnant women, 24 alone in the past 90 days.
And what medications are you actually prescribed?
Without help, their addiction can now send them to jail under a new law that classifies it as a misdemeanor offense. This week, 27-year-old Lindsay Davenport became the first woman to be charged in DeKalb County after her newborn tested positive for methadone, morphine, and a medication used to treat opiate addictions.
In Tennessee, unfortunately, the number of addicted women who are pregnant that are seeking treatment is twice the national average.
In fact, prescriptions have topped alcohol as the abused substance of choice in the state, and treatment specialists warn is often a gateway to even harder drugs.
Prescription drug addiction can lead to heroin addiction, and the reason is when you can't have access to prescription drugs anymore, the next best, cheapest option is heroin.
The goal of the law is to be a deterrent and use the legal system to mandate treatment through drug court or punishments like jail time.
It is a disease. Nobody gets up in the morning to decide I'm going to be addicted to Percocet, and then I'm going to get pregnant, and then I'm going to go to jail.
It's a disease that can be cured. Treatment can begin with a phone call and a desire to kick the habit once and for all.
There is help. You can get better.
Davenport's bond is set at $2,500 and she'll appear in court on April 9th. Meanwhile, the addiction campuses will find treatment options for anyone who calls, no matter if they have insurance or not. Scholarships are available. You can reach their hotline. That number is 1-888-614-2251. That's available 24 hours a day, 7 days a week.